Hi, everyone. This is Brian Zimmerman with Becker's Healthcare. Thank you for tuning in to the podcast. Today, I'm thrilled to be joined by Liz Cunningham, Vice President of Digital Solutions, and Holly Holtz, the Vice President of Strategic Operations at AMN Healthcare. Thank you both so much for being here today.
Hello, thanks for having us.
Thank you.
And today, we're going to discuss how advanced analytics and integrated systems can really help build flexible internal resource pools to support the healthcare workforce, which is so critical right now. But before we dive in earnest here, I'd love to have each of you just share a bit more about your professional background, your role at AMN Healthcare, what you're doing right now. Holly, I'll tap on you first to get going.
Wonderful. Well, thank you so much for the opportunity to be here with you today. And a little bit of my background is I have been in the workforce planning and scheduling software for about 20 years within the healthcare space and have helped develop one of the #1 performing software systems in the scheduling and staffing sector of the healthcare industry. And I currently work with organizations all across the country to help them develop a sustainable workforce plan and deploy as much automation as we possibly can to help get the right clinician to the right place to help their patients and keep their staff happy.
Great to have you. Certainly the right person to have on for this topic. Appreciate you being here, Holly. And Liz, let's meet you now.
Thanks, Brian. Hi, my name is Liz Cunningham. I am responsible for digital solutions across AMN Healthcare. And really what that means is myself and my team are responsible for the digital products and experiences that interact directly with our customers, whether a healthcare client or a clinician seeking a job or part of a float pool or any sort of additional type of staffing that that client or clinician might be interacting with us.
Excellent. Well, Liz, of course, a pleasure to have you here as well. Let's get into the conversation here now. So, in the current environment, health systems really do need flexible workforce solutions. I think it's safe to say more than ever. It's certainly true of you hear it about sort of newer clinicians coming into the workforce want flexibility, and even what have been called sort of boomerang nurses, for example, also will come in with different expectations than they had in the past, wanting more flexibility. So I guess we want to start here by getting some more conversation around the trends you're seeing right now as the organizations you work with are really on this journey to try to achieve that added level of flexibility in the workforce. Holly, you want to get things going here?
Yeah. Thanks for the question. And I agree with you, Brian. The demand for flexible solutions is at an all-time high right now. And we've seen a lot of clients taking the lead and seeking out various sources of staff and pushing out some creative solutions that we haven't seen before. And just as you said, we're seeing workers that are demanding flexible options. This generation wants more flexibility than ever before. And we're also seeing clients who want to achieve the right mix of their workforce. How much core staff do they need? What flexible forms of resources they need? How much contingent contract labor do they need? So we're seeing all these things kind of come all together. And in my experience, it's been key for clients to have a partner who can help them determine those strategies, as well as a partner who can offer the depth and breadth of solutions that they can tap into. And this is where we see more of the conversation around the different types of internal float pools and internal agencies come up as solutions that they're tapping into first before they're seeking additional contract labor. And this is where I want to talk a little bit about the ambiguity around the definitions that we've seen out in the market around internal float pool and internal agency. And what we're seeing happen across our clients is I'm going to talk about those two buckets. Is the internal float pool, what we've seen them to be is a group of clinicians that can be deployed to units within a few days or even a few hours before the start of the shift. And mostly these clinicians are a mix of RNs and certified nursing assistants and techs. And the interesting piece is they're a mix of full-time, part-time, or PRN staff, and they're typically hired as employees to the health system. Whereas the internal agency pool is where I think it gets really interesting, and I think this is a really fun, creative solution, where they're groups of clinicians that make a commitment for a certain number of weeks. We're seeing somewhere between 8 and 12 weeks, sometimes 16 weeks, as a short-term contract to work within the health system and float around to the highest need or even be committed to a specific unit. Now, this is the interesting part where the clinicians are either hired into work as an employee of the health system with these short-term contracts, or we've seen clients comprise those pools of contracted labor from local agency pools or from longer term contracts. So I think that these are the flexible solutions that we're going to be seeing evolve going forward and getting more creative to keep resources there in a creative way and incentivize them to stay that meets their flexible needs.
And let's get into sort of how they go about determining the right mix here. You laid out some of the different sort of um, the internal flow pool, internal agency pool, these different levers that sort of partners are pulling. I guess maybe zooming out, but also kind of zeroing in at the same time. How can facilities be more strategic about really figuring out what the right workforce mix is for their organization?
Yeah, great question. And it is such an important topic, Brian. It is a critical strategic imperative that I believe that health systems need to have a focus on. Doing this will help them maintain financial stability and it'll also increase their patient satisfaction and staff satisfaction. So where I would recommend organizations start is looking at deploying a repeatable method and looking at 3 buckets of data. First off, how are they using their current staff? Secondly, how are they meeting their patient needs? Like how well are they able to fulfill their patient demand? And the third one is what is their overall financial picture and by type of staff? So looking at those 3 buckets of information, the next steps then would be to look at what is the optimal mix. They need to really look deep into where they're at in their current situation and ask themselves, what do they want their internal float pools to look like? What are their primary focus points to add more core staff? What are the main financial drivers to put a focus around to reduce expensive forms of staff like overtime, premium pay, or contingent contract labor? So once you have the vision, then it's about developing a plan that's going to move that resource mix in the direction of their ideal plan and designing, hiring plans accordingly. So if they know, okay, we know we want to have an internal flow pool and an agency pool, how many do we need to have in each of those buckets and how are we going to hire those differently? How are we going to incentivize those people? Now, I acknowledge I may have made that sound really easy, but I assure you it is not an easy initiative. It involves gathering a lot of complex data sets and compiling them to help health systems make informed decisions. We've done this hard work and we've developed a workforce planning dashboard that has these specific outputs in place. And we have a workforce strategy team that will partner with organizations to help them design the ideal state and develop a plan to get there. But in summary, I encourage health systems to start a repeatable process that looks at how you're utilizing your staff, look at it quarterly, and quarterly discuss the ideal vision to make strides towards a sustainable workforce. And we're here to help if they want to get there faster.
Yeah, and yes, should be said. Nothing we're talking about here today is necessarily easy, but as the adage goes, right? If it's not hard, it's probably not worth doing. Right on.
Right.
All right, and let's turn to the technology component here. Of course, that is critical to executing some of the work that Holly has laid out so far. Of course, thinking about planning, managing, and implementing the sort of this tech first internal resource pool. Liz, can you walk us through that? This process of planning, acquiring, and deploying a solution like this to staff?
Yeah, absolutely. I think Holly's point, it all starts with planning. And when you think about the various attributes of the planning around staff and patient needs and financials, that just screams a need for aggregating a lot of different data sources. So when it comes to looking for technology partners, it really needs to start with what sort of data and analytics solutions does the partner have to be able to help you do that initial assessment to plan. But it's also about the ongoing assessment and predictive analytics around what are your future needs going to be and how do you continuously train a model to look at, quarterly, seasonally, monthly, even weekly, what type of staff am I going to need to fill various types of holes and when. So really starting with that analytics platform is the first step. After that, you really need to figure out, okay, what do my pools need to look like? And whether it's an internal float pool that the client is employing themselves, whether it's an internal agency that's a combination of outsourced contract labor, having the right sourcing capabilities to fill that pool is going to be key. So how do you think about attracting the right candidates at the right time, associating them with various geographical locations that meet the needs of your float pools and your schedule, and then actually credentialing and getting them compliant to be able to meet the needs of various units and facilities. So once you have the plan and once you have attracted the pool, then you need to look at how am I actually getting shifts to this pool. So you see a lot of technology capabilities out there right now focused on candidate self-service and matching. And that's really one of the critical unlocks that relate to what a candidate or a clinician in a float pool is looking for. We see in a lot of different research that candidates that are part of float pools really view self-service and the ability to manage their own schedule as a critical capability that's required for them to be satisfied working in a float pool. And from a technology perspective, to facilitate that, you have to have things like the correct matching. So think about, I'm a clinician and I'm an ICU nurse and I only work within this 50-mile radius. How am I getting the right shifts matched to me based on my availability, my credentials, so that I can self-serve? That's a critical capability. And then in addition to that, thinking about how you actually are recommending maybe other shifts or other units to those clinicians that they might not have been thinking about to also help you fill those needs. So really those three, it's the planning, the sourcing, and then the self-service for actually getting those shifts into the hands of the float pool.
And of course, it should be said too that bringing on new technology can be a challenge. Managing through that is barriers can come up. Change management can be a challenge. I guess my question then for you, Liz, is how can health systems do this in the most efficient way possible when they're talking about sort of embedding internal resource pools here into these existing workforce ecosystems? What advice would you have for folks out there?
Yeah, I absolutely, I love talking to clients about how they're thinking about float pools. I know that's something Holly's really passionate about too, because it's not really just about the technology that you purchase or partner with to run your float pool. It's about how you think about that technology integrated with your broader healthcare technology ecosystem. So when you think about running a float pool, you have to think about things like badging, which might sound really simple, but you have to think about, hey, if I have these 5 clinicians floating across these 5 facilities, does one badge work for all of those? Or do I have to figure out a way to have a badging system that works across all my facilities? Do I have to think about anything differently with my various EMR systems? Do I have to think about things differently with time entry, with pharmacy codes, things like that? So there's a lot of internal kind of process improvements and technology capabilities that need to be enabled to then make the float pool able to work within the health system's existing technology ecosystem. So that's really the first thing that we partner with health systems to think about and help advise them. And then beyond that, if you have, all of your internal capabilities figured out, it's then about how are you actually thinking through the shift distribution to your float pools. So, there's complexity around core staff versus flexible staff. And what are the rules in terms of how long do I have to have a shift available to my core staff before I can release it to the float pool, as one example. Another example might be, how do I look at overtime rules or various other employment rules around, okay, this clinician has already worked 40 hours this week, so I need to then distribute shifts to this other pool who have only worked 30 hours this week. So that rule distribution and that complexity is something that really needs to be thought about upfront before implementing a float pool. But there's also a lot of technology capabilities out there to automate that once we partner with the client to actually figure out those complex rules in the front end.
Thank you so much, Liz, for going into some detail there for us. I think the last question here I want to ask, which is really talking about the solution. It's not just about sort of managing people, right? It's also about managing and organizing costs, and achieving that right mix of core, contingent, and flexible staff is really essential to controlling costs in today's healthcare ecosystem, of course. So I guess the question I want to put to, and I'll put it to you, Holly. What are the cost savings results health systems are seeing by achieving sort of a more balanced workforce? So the systems that have done what we've talked about today, what does this do for their labor costs?
Yeah, thank you for the question. The organizations that we have worked with have recognized significant cost savings by deploying these strategies and the right mix of workforce. On average, our organizations have saved between 4 and 7% of their total labor costs. specific outcomes that we've seen across the variety of our clients is a reduction in overtime from 15% to 6% of total hours. We've seen an organization reduce their incentive pay by $1 million in the first year of deploying these strategies. And on another point, we've seen an increase in employee engagement, where many clients have reported staff satisfaction scores improve. And one specific organization reported a 4% decrease in their turnover, which, as we know, turnover is a big deal across the industry and a large cost savings initiative. We've heard from other clients that those clients who found it really difficult to hire in their specific geographic location, that by deploying these flexible strategies for internal float pools and agency float pools, they've been able to increase their float pools by having those strategies in place. In fact, one organization in 10 months was cited a $12 million savings by doing these and deploying these strategies, and they increased their float pool by 46%, which really drove down other areas of expensive forms of labor that we've talked about, like the overtime and premium pay and contract labor. So that is a significant savings to organizations if they're deploying them in the right manner and really having the narrow focus to do so. I also want to note there's a level of soft savings that have also been achieved with the right technology. As Liz alluded, you have to think about the full ecosystem. And if they are all working together and everyone's doing their part and following their workflows, we've seen a time savings for creating a great schedule go from 13 hours a week to 6 hours. We've also seen post-schedule time card reconciliation and the decreasing the recruitment efforts by having these flexible forms of resources in place. We've seen a decrease of 25 hours to 7 hours in a week, where they're spending a quarter of their time on doing those workflows versus one day. So it really is about having the right people at the right place at the right time and building tomorrow's workforce with that repeatable, sustainable approach and having the right technologies in place so that you can attract the clinicians to your facility that are going to also consider your organization as like the employer of choice.
Oh, well, Holly, those are some impressive results, and I appreciate you sharing that with our listeners today. Well, Holly, Liz, it's been a real pleasure talking through sort of these workforce-related issues in healthcare today, and talking about how listeners out there can achieve a more balanced workforce, more flexibility at their organizations. Before we close, is there anything you'd like to add? Is that where can listeners go to learn more? I guess is how I'll phrase it. Liz, I'll turn that to you.
Thanks, Brian. One of the takeaways I'd love for everyone to be left with is, all of the services and the consultation that Holly has mentioned and the various technology capabilities that I've mentioned are all things that AMN Healthcare has as a technology or can partner with our clients to solve. So we really wanted to say, if you want to learn more, request a consultation, please reach out to us at amnhealthcare.com. We're happy to hear about your vision for your internal float pools, ideate on what an internal agency could look like, or just be a general partner for any healthcare needs. So thank you, Brian.
Holly, Liz, thank you so much for coming on the podcast and walking through this with me.
Thank you for having us.
Yes, thank you very much.
I also want to thank our podcast sponsor, AMN Healthcare. You can tune into more podcasts from Becker's Healthcare by visiting our podcast page at beckershospitalreview.com.